Hello everyone. Welcome to part 3 of the lecture series on Armamentarium for local anesthesia. Today's topic is dental cartridge. Cartridge, by definition, is a container that holds the local anesthetic solution. I'm sure many of you would think that this is not for you because we do not use it that commonly. So let me first explain why we need to change our mindset and use this whenever possible. Then I'm certain you will be able to relate to whatever I would be explaining during the course of this lecture. In addition to the description about the cartridges, this lecture will also feature demonstration video of computer-controlled local anesthetic delivery system. Let me start with what we commonly use. We use small bottles as what is shown here in our practice. This is called as a multi-dose vial. We draw the local anesthetic solution using a disposable syringe and feel safe that there is no cross-contamination. But even though we use a disposable syringe, every time we draw from the bottle, there is a possibility of contamination of the solution for two reasons. One, the solution gets contaminated because of multiple withdrawals, even if it is for the same patient. Secondly, there is a risk of cross-contamination when you use it for different patients. Well, there is another problem too. Once open, we may not use up the whole bottle in a single day. So the solution is exposed to the exterior through the needle that we generally insert into the rubber lid for withdrawals. Now this can cause changes in the solution from degradation to oxidation and also change in pH of solution. Now how is this important to us clinically? Such solutions can cause burning sensation during injection. So patient's comfort during injection is definitely compromised. The next important aspect is about the presence of methyl-paraben in these vials. Methyl-paraben is an established allergen. But here comes the most interesting fact. Did you know that methyl-paraben was banned by FDA way back in 1984? But we use it quite frequently. This aspect definitely needs introspection. Apart from these, when you use a multi-dose vial, there is always a possibility of loading more than what is necessary because it is manual and hence one needs to be cautious. Additionally, not all local anesthetic agents are available in vials, especially a few of the good formulations. For example, articaine and mepivacaine with levonorepinephrine. Now, why are they special? Let me explain. A single buccal infiltration of 4% articaine can ensure effective anesthesia without any palatal injection. It is less toxic, has faster onset, longer duration of action, and higher success rate. Also, it is safe in patients with liver and kidney disease. With so many advantages, why would we avoid this? I don't think we're justified in doing so. Regarding mepivacaine with levonorepinephrine, here levonorepinephrine is the vasoconstrictor. This gives prolonged duration of anesthesia with lower risk of cardiovascular complications compared to epinephrine. So these cartridges must definitely be considered for use in one's practice. In contrast to all the disadvantages associated with a multi-dose vial, a cartridge is tight sealed. There is no contamination at all. It is convenient to use, preloaded, providing constant dosage. It does not contain methyl-paraben, and all possible local anesthetic agents are available in cartridges. Now that we have enough reasons to choose a cartridge, let's focus on that. Now here's some interesting history. During World War I, an American Army physician, Harvey Cook, he invented the anesthetic cartridge. He based his idea on the cartridges used in a gun barrel. In fact, he cut the glass tubes himself from the laboratory tubing. In 1927, Cook Laboratories produced the first glass cartridges in a commercial manner. In 1928, Bayer Dental, they developed the first sealed cartridge for dental anesthetic under the trademark Carpule. That is why sometimes people use the term Carpule for cartridge, but now we know the difference. Carpule is exclusive to Cook Weight company. Let's now go into the finer details of a cartridge. So a cartridge is a single-dose cylindrical device constructed of glass. It has a stopper located at the end of a cartridge that receives the harpoon of the aspirating syringe. The aluminum cap is located at the opposite end of the cartridge to hold the diaphragm in its position. The diaphragm is made of rubber, and this is where the needle is inserted. Here is the position of the cartridge in relation to the syringe as well as the needle. The harpoon on the plunger of the aspirating syringe engages the rubber stopper located at one end of the cartridge. The rubber diaphragm allows for penetration of the needle into the anesthetic cartridge. The volume of solution present in a cartridge is standardized. That's a huge advantage because one does not make the mistake of injecting an overdose. But the volume varies according to the companies and countries. In the US, it is 1.76 ml of local anesthetic solution. In the UK and Australia, 2.2 ml. In India, 1.7 ml of LA solution. But remember, the dosage is calculated as 1.8 ml. This picture is a good guide to assess the volume of solution used in clinical practice. Remember, the space occupied by a plunger is 0.2 ml. So every full movement of the stopper results in expression of 0.2 ml of LA solution. So this is a reliable indicator of the volume of drug injected as observed through the large window of the syringe. Surrounding the cartridge is a thin plastic mylar strip which provides information regarding the contents of the cartridge. Information such as the manufacturer's details, the lot number, expiration date, the manufacturer's details, and the volume of the solution, also the proprietary and generic names. Also, the mylar strip protects the patient in case of glass rupture. So that's a very important feature. The dental cartridges are color-coded to indicate the concentration as well as the type of anesthetic and vasoconstrictor which is present inside. The American Dental Association adopted this color coding system in 2003. For example, green indicates lidocaine cartridges with 1 in 50,000 epinephrine, and red indicates lidocaine cartridges with 1 in 1 lakh epinephrine. The color bands are indelible and completely encircle the cartridge for easy visualization. The bands have specific widths and placement. Although color coding is useful, dentists should still read the labels of all drugs that they administer. It is a good practice to follow. Local anesthetics are marketed in blister packs of usually 5 packs of 10 cartridges each. In some countries, local anesthetics are still available in tins of 50 cartridges. Now, multi-dose vials are available in different concentrations. This is a very familiar sight to us. Multi-dose vials are usually available in transparent bottles, like what you see above. But it is important to be aware of the fact that local anesthetic solutions should not be left exposed to direct sunlight because some of the contents may undergo accelerated deterioration. The primary clinical effect of this will be destruction of the vasoconstrictor with a corresponding decrease in duration of clinical action of the anesthetic solution. Secondly, exposure to light can cause change in pH. This leads to increase in acidity of the solution as the vasoconstrictor is oxidized. This leads to increased discomfort to the patient. Hence, multi-dose vials are also available in ambered colored bottles, which protect the contents from degradation caused by light exposure and also maintain its potency and effectiveness over a period of time. When you use a multi-dose vial, you could consider using a syringe bottle adapter for easy withdrawal of local anesthetic solutions. Now let's have a quick comparison between cartridges and multi-dose vials. Cartridges need a cartridge syringe. They are convenient to use and they maintain sterility of the solution. They provide constant dosage. Each cartridge contains about 1.8 ml of solution. And these do not contain parabens because it is single use. You do not need antimicrobials. While a multi-dose vial needs a disposable syringe for delivery and administration, they are convenient to use. However, they are not sterile. There is a possibility of cross-contamination. Also, the dosage may not be constant. One needs to be very cautious to avoid the risk of overdose. And these contain parabens because of multiple use. And these vials contain about 20 ml, the usual formulations. Cartridges are packaged inside pre-cut individual blisters, which protects them from cross-contamination. It is not necessary to take additional steps to clean the cartridge prior to use. They are considered clean as they come from a container, so you don't have to autoclave, because this may damage the cartridge components and also cause the epinephrine to degrade, as it is a thermolabile substance. Also, another frequent mistake that everybody makes is immersing a cartridge in disinfectant solutions. This is discouraged because disinfectant solutions can diffuse into the cartridge and thus contaminate or alter the properties of the anesthetic solution. If there is any carelessness in handling of the dental cartridge after you have removed from the packet, the sterilized one, and there is a concern that it is contaminated, it can be cleaned with a swab soaked in 91% isopropanol or 70% ethanol. Here are a few tips about storage of cartridges. Cartridges should always be stored protected from light in their original packaging and kept at a temperature not exceeding 30 degrees centigrade. Although cartridges are present in pre-cut blister packs, they should not be stored outside the carton, as light may degrade the contents of the solution. This has been discussed in detail earlier. In other words, it is recommended to store the cartridges in their original container, inside the blister and inside the carton until they are to be administered. Some dentists warm the solution for patient comfort during administration. But remember, heating the solution may cause discomfort and faster degradation of the vasoconstrictor epinephrine. Various studies have shown that heating the solution to 27 degrees centigrade or higher can cause patients to feel burning during administration. In addition, the degradation of epinephrine shortens the duration of anesthetic effect, which may cause even more discomfort for the patient. Similarly, it is not advisable to refrigerate or freeze dental cartridges. The mechanical effect of cooling or freezing could cause the liquid inside to expand, causing leakage or material integrity problems. If this occurs, the solution may become unsterile and unsafe to use for injection. Cartridge warmers are available in the market. They have been designed to maintain anesthetic solutions at body temperature. This is what their claim is. But these are not needed and cannot be recommended. Local anesthetics in cartridges maintained at room temperature do not cause the patient any discomfort on injection into tissues, nor do patients complain of the solution being too cold. In contrast, warmed local anesthetic solutions at 27 degrees centigrade or above have a much greater incidence of being described as too hot or burning on injection. Some dentists use plastic cartridge dispensers for ease of working. If a clear plastic cartridge dispenser is used, 1 day's supply of cartridges should be placed with the aluminum cap and diaphragm facing downward. Several sterile dry gauze pipes are placed in the center of the dispenser and are moistened with 91% isopropyl alcohol or 70% ethyl alcohol. No liquid alcohol should be present around the cartridges. Before the syringe is loaded, the aluminum cap and the rubber diaphragm are rubbed against the moistened gauze. Now, there are a few aspects that one needs to observe before using a cartridge. To begin with, a bubble in the cartridge. Now, if you find a small bubble, it is usually introduced during the process of manufacture. These bubbles are composed of nitrogen gas, which are basically introduced into the cartridge to prevent degradation of the vasoconstrictor epinephrine. But if you find a large bubble that extrudes beyond the rim of the cartridge, this indicates freezing, and hence it should not be used. Some cartridges may have a sunken or bulging membrane appearance, which is merely a cosmetic detail that does not affect the sterility of the solution or the integrity of the cartridge. And this is usually due to the effect of the filling process during the fitting and adjustment of the cap. You do not have to worry about this. But leakage from the end of the cap usually deserves attention. This happens if the needle and cartridge have not been prepared correctly or inserted correctly, and if the needle puncture in the membrane is not centered. That is, if it is ovoid and eccentric, this causes part of the solution to leak between the needle and the membrane when the piston is pressed. The risk of leakage can also increase when the syringe is manipulated during injection, as it can cause the needle to move in the membrane and cause tear in the membrane. A damaged plunger can also allow the anesthetic solution to leak from the cartridge. A dental syringe harpoon that has not been centered on the piston can increase the risk of solution leakage during injection. Moreover, the same risk is increased by the use of defective or poor quality syringes. Ideally, the plunger should be fully inserted into the cartridge. If the plunger protrudes and is accompanied by a large air bubble, this indicates that the cartridge was exposed to freezing or heating, which causes the liquid inside to expand. On the other hand, if the plunger protrudes but there is no air bubble, it is because the cartridge was immersed in a disinfectant solution and the solution was able to diffuse into the cartridge. In both the cases, do not hesitate. The cartridge should be discarded as the anesthetic solution is contaminated for sure. Sometimes you come across a sticky plunger. Now, what is this? A plunger that does not slide properly, smoothly through the cartridge cylinder. This could be caused by the syringe harpoon not being properly engaged in the plunger. But the other possible cause could be, although it is rare, is that the plunger is not uniformly siliconized. Basically, it is the lack of lubrication. The next point of concern would be the presence of solution between the plunger grooves. Now, this is an indication that the integrity of the closure system is compromised, and therefore there is a possibility that the solution is contaminated and its administration would put the patient's health at risk. The Parenteral Drug Association considers this problem as a quality defect, and therefore cartridges with this defect should definitely be discarded. The next important clinical aspect. Remember, all glass and polypropylene dental cartridges are transparent so that the contents of the anesthetic solution can be visualized before every injection. If one finds that the solution is found to be cloudy or it contains particles or has changed color, then do not hesitate, discard the cartridge. This is very obvious. A cap that shows any damage, either corroded or rusted or appears dented, is definitely an indication to discard the cartridge. It just indicates that the hermetic seal that the cap creates when it fits over the neck of the tube may be compromised and affect the sterility of the anesthetic solution. After administration of the local anesthetic solution, the cartridge needs to be disposed of. Now, this is based on their contents and grading such as sharps, pharmaceutical waste, or trash. Remember to follow the FDA guidelines. To begin with sharps. If the cartridge contains blood, it is considered a sharp. and should be placed in a sharps container. If the cartridge is broken but does not contain blood or medicine, it can be placed in a sharps container to protect against broken glass. Sharps container must be rigid, puncture proof, and have secure lids. FDA also states that sharps containers must be absolutely discarded when reaching the fill line on the label, which is approximately 3/4 full, not completely full. To avoid contamination and injury, containers should not be overfilled. If the cartridge contains medicine, it should be placed in a pharmaceutical waste container. This includes partially used or expired medications. So these carpules are disposed of as pharmaceutical waste and transported to a medical waste incinerator. That's the final point. There's another category called trash, and this includes cartridge which is empty, unbroken, and contains no medicine or blood. These are placed in trash. Let's now move on to a very important aspect of clinical practice but much neglected. So remember, included in every package of local anesthetic is an important document called the drug package insert. This contains valuable information about the local anesthetic solution such as the dosages, warnings, precautions, and care and handling instructions. All persons involved in the handling or administration of local anesthetics should review this document periodically. There is no compromise. This helps us to be always prepared for emergencies and also to avoid any complications. We now move on to the more sophisticated form of local anesthetic delivery, a computer-controlled local anesthetic delivery system. This is a computerized device that controls the flow of local anesthetic solution into the body. It's used in dentistry to reduce pain and any kind of discomfort during the procedures. Let's first understand why and how this idea actually originated. With conventional systems of local anesthesia delivery, the dentist needs to focus on many aspects simultaneously. One has to direct the needle precisely through the tissue planes, at the same time aspirate, control the flow rate, dose, and at the same time manage the patient's fear of needle and pain. Can you believe this? Computer-controlled local anesthetic systems negate all the above. Numerous systems are available in the market. These devices have varying characteristics such as design, injection speed, shape, weight, and possibility of aspiration. It is important to choose the appropriate product based on operator preference. The first C-CLAD device to be introduced is the single-tooth anesthesia wand system in the year 2007. This device controls the flow rate of the anesthetic in a slow and steady manner. As you all would remember, slow injection means no pain. The wand is the syringe, which is held like a pen, and you have a foot pedal which controls the rate of injection. The device also provides a real-time pressure feedback to help in delivering the anesthetic more precisely according to the tissues into which you insert the needle. The wand system provides many benefits over conventional syringes. It reduces pain and anxiety for patients. It can be used in difficult areas, example the palate, where the soft tissue is less elastic. It can make injections more comfortable for patients, especially for those who have had bad experiences with needles in the past. It can make injections more comfortable for dentists because it is more ergonomic. The grasp that we use is that of using a pen. This is more comfortable to your fingers. Also, this system can be used as a predictable primary injection and not as a supplementary injection. One of the special features of the wand system is the dynamic pressure sensing mechanism. This gives visual feedback regarding placement of the needle into specific tissues. This is especially useful with intraligamentary injections. Let me explain in detail. This system has a panel with numerous color bars. As you insert the needle into the tissues, if red color lights up, it indicates low pressure. Orange or dark yellow pressure indicates pressure which is high but not adequate. Light yellow indicates correct pressure, which means that the syringe is exactly in the PDL space, and that is where you inject the LA solution. Not only that, as you reach the PDL space, which is your target area, you also have an audible feedback regarding the placement of the needle. So you have a voice saying PDL, PDL, which is very, very helpful to a dentist. Additionally, with wand, you have features which help in aspiration also. With the original wand device, the aspiration time duration was 14 seconds, but with the newly developed device, the aspiration time is 5 seconds, which is much more convenient to a dentist. Today, we have newer generation computer controlled local anesthetic delivery systems. The wand had a cord and a foot control. But these devices are free of tubes and cords. They fit into your hand and very, very convenient to use. One of the examples include the ICT system. This is a cordless one. I'm going to use this system to demonstrate to you how the computer controlled local anesthetic delivery system works. So this is the Armamentarium setup for the computer controlled local anesthetic delivery system. That's the needle and cartridge. These are what we generally use with the cartridge syringe system. This is the cartridge holder with two windows, small and large. And this is the C-CLAD device. The device is powered by a rechargeable battery which can be inserted and removed from the rear end of the device. It has a power switch to switch on. That's a switch. It's being switched on, and you see that as an electronic display. And there are two buttons in the front to control delivery and speed. Now a closer view of all these buttons. The front button is used to eliminate air inside the cartridge and needle. It has 3-level adjustable injection speed, and the rear button is for temporary pause of injection and to initialize injection. This is the power button for on and off. This is the cartridge holder. Now we load the cartridge into the holder. Now the cartridge holder is inserted into the C-CLAD device. The needle being secured to the device. Make sure it is secured properly. It is threaded nicely. And the device is ready for use. Now this is very interesting. You have a bevel indicator, the black arrows which shows the orientation of the bevel to identify once the needle is inside the tissues. So now the assembly is complete. We're going to start now. The power switch turned on. Once it's turned on, you see the display activated. Now delivery is controlled by using the speed settings. The first is the slowest speed. You can see the trickling of local anesthetic solution through the bevel of the needle. The speed is really slow. Now we move on to the second or the intermediate speed. Once that is pressed, you see the change in the setting on the display board. Now you can see it's very obvious the speed is intermediate, much more than what it was in the first setting. Now we move on to the third. This is the fastest speed. There it's changed on the display. Now as you can see, it provides a continuous stream of local anesthetic solution. So this is how we modify the rate of local anesthetic solution with a pen grasp. So it is ergonomic because we are using the pen grasp as we insert the syringe into the tissues of the patient, and we are able to control the speed of local anesthetic delivery. Once the procedure is completed, the needle is sheathed and we are ready to dismantle the device. The needle is removed carefully. I am removing the cartridge holder and the cartridge is removed. With this, we come to the end of lecture 3. Here are the key points. Cartridge is single-use unit with pre-filled volume without methyl paraben. Multi-dose vials contain paraben and also carry the possibility of cross-contamination, and they do not have all LA formulations, especially articaine. Cartridge warming is not recommended. Before using a cartridge or multi-dose vial, always check for physical integrity of delivery system and also the chemical stability. For disposal, follow the FDA guidelines. Consider computer-controlled local anesthetic delivery system for the benefit of dentists as well as patients. Thank you.